Student nurses, this is Introduction to Nursing Research. The first topic that we will discuss is the definition of research. For us to work on research, we need to understand what research is. It's not the usual notion that we do that when we search in either Google or Yahoo or any search engine available to us, we think that we're already doing research. But that's not actually research, that's just a search. So let's define what is research. Research is a systematic inquiry that uses disciplined methods to answer questions and solve problems. Pollitt and Beck in 2008. So when I say systematic inquiry, it follows a certain steps, it follows a certain order of steps in order for us to come up with a valid results and conclusion. I could not just go around and say ask people randomly and then conclude that it will be research. Then it will be the disciplined methods. So when I say disciplined methods, it's developed across time. It's developed by several scholars when it comes to the conduct of the study. It could not be a method that is done overnight and then not investigated on. Okay, so it needs to be a disciplined method. So for example, if you're doing qualitative research, let's take for example, lived experiences of farmers in the time of COVID-19 pandemic, we need to understand that a single interview with a respondent could not commensurate to a research without following the guidelines or without following the methods for analysis prescribed by authors in qualitative research. Now, what is the goal of this research? Okay, for example, you might be interested again on the lived experience of those farmers. You need to be able to answer the question, what are the lived experiences of this certain group of people? And our main aim is to solve problems. We don't just conduct research for the purpose of knowing, although there is basic research, but the overall goal of research, according to Pollitt and Beck, will be to solve problems. Okay, other authors would say that the overall goal would be to improve the nursing practice. That is if we're talking about nursing research. So take note of the words highlighted: systematic, disciplined method to answer questions and solve problems. The next definition is from Webster. It is a studious inquiry or examination, investigation, or experimentation of facts. Now look at that, inquiry or examination. So this delves into several methodologies. So you have your narrative inquiry, you can have your qualitative inquiries, you also have your comparative studies. Okay, it could also be an investigation or experimentation of facts. When I say experimentation, we could possibly experiment on drug ABC on its possible efficacy on decreasing the viral load of COVID-19. Now, revision of accepted theories or laws. Not because theories or laws has been there or have been there, okay, they're already infinite for existence. So one of the attempt of the research is to update the existing theories, okay, especially your theories. Take note that our theories are subjected to testing, and research is the way to test our theories. And that is in the light of new facts or practical applications of new or revised theories or laws. So take note that whenever there is emergence of new technologies, new methods, new possibilities, the conduct of research is becoming more feasible. Okay, not because something is new, we always perceive it to be effective, and not because something is new, it will always be efficient. That's why we need to conduct research. And it is research that will be able to justify whether this alternative will be cost effective or not. For example, if I will be looking at the use of MRI, the magnetic resonance imaging, in the diagnosis of a patient with spinal cord injury, will I really need MRI or will CT scan do because CT scan is cheaper compared to MRI? So now we know that studies have shown that MRI could show clearer images of the spinal cord damage. That's why your MRI is still recommended for us to find out the extent of damage of a patient with your spinal cord injury. So those are some of your considerations when you are doing your research. Next, according to Barr, it is any systematic search for understanding limited to a particular subject. Okay, so it is focused on a specific subject. For example, I could not just say I would want to study the mental health of the student nurses. When I will be wanting to study the mental health of the student nurses, I need to have the specific indicators for the mental health of the students. Okay, so what do I mean by mental health? It is not a vague concept or construct wherein I could just fairly define whatever I like it. So it needs to be conceptually and operationally defined. So when I say operationally defined, you should be able to specify as to how to measure this variable, okay? Because it will help us have an understanding to a particular subject. And what do researchers do? We make the best problem out of the situation that we have at present. What do I mean by having the best problem? Not that we are creating the problem, but we are able to describe the problem in detail in such a way that we will be able to measure the problem or find ways to investigate about the problem. Okay, so if you would pull out quotes from Einstein, for example, he would say that half the process in problem solving is identifying or describing the problem itself. That is the same in research. If we are able to describe the problem, okay, in a very descriptive way, in a very concise or comprehensive way, we will be able to deduce if what is the problem, and later on, we will know if what will be the direction of our solution. Okay, let's point out, for example, if I conducted a study on mental health. Okay, let's say, for example, I did a study mental health of student nurses, and then I found out, or the conclusion goes, the student nurses have good mental health. What do you mean by good mental health? Does it mean that the students are sleeping well? Does that mean that the students are coping properly on their problems? Or does that mean that the students are emotionally responsive to their problems? And what do I even mean by emotional responsiveness? So we need to be able to limit if what are the guidelines or what are the things that we need to focus on in the study of research. The next definition comes from Trees and Trees. Trees says that research is an attempt to gain solution to the problem. So again, solution to the problem, just like a bullet in back. It is the collection of data in a rigorously controlled situation for the purpose of prediction and explanation. If you would look at the latter part of the description given to us by Trees, this is actually focused already on experimental research. A rigorously controlled situation can be ideally done in a pure experimental research, not even in a pre-experimental or quasi-experimental type of research. Now, if I would want to explain the purpose, for the purpose of prediction and explanation, that's still your experimental research. Although there are descriptive studies that is capable of prediction. So this could be done using your regression analysis. Okay, so studies using regression analysis will be able to allow in doing some predictions. What do I mean by predictions here? Let's say, for example, I would want to know what is the risk of contracting diabetes mellitus if my father has diabetes mellitus. Your regression analysis will be able to give us the odds ratio or the likelihood, of contracting the disease while you have those facts available to us. Next, explanation. There are several researchers that could seek to explain. So you also have your descriptive research, you also have your qualitative researches because they could explain a certain phenomenon. Why is it occurring? So basically, it covers several designs in research. But when I talk about rigorous controlled situation, it is more likely to be inclined on experimental researches. The next definition is not the best. So research is formal, systematic. We'll talk about that. Now, highlight intensive process of carrying on a scientific analysis. As I would always say to the learners of research is not difficult, but research will surely be intensive. Okay? The difficulty of research may be a subjective experience. However, I'm sure that it will be an intensive process because research could not be done overnight. Research could not be done in a glimpse of an eye. It needs to follow intensive processes for the purpose of discovery and development of an organized body of knowledge. So our goal is organized body of knowledge. Take note of those words. Next, according to French, research is essentially problem-solving, systematic, intensive, directed toward fuller scientific knowledge of the subject being studied. Okay, so it's almost an amalgamation or combination of the previous definitions that we had. Now, according to the Committee on Research of the Philippine Nurses Association, so this is our own accredited professional organization here in the Philippines, research is an honest, the big word is honest, scientific investigation undertaken for the purpose of discovering new facts and establishing new relationships among those facts already known, which will contribute to the present body of knowledge and can lead to effective solutions of existing problems. Let's put our attention in honest. Honesty is a big word in research. Okay, as a professor of mine would always say, statistics don't lie. Again, I would like to repeat that. Statistics don't lie, but statisticians do. I don't want to judge statisticians, but just for you to get the perspective that in the same reason that the method of research is not lying, but the researchers could possibly do. Okay, so as nurses and even as researchers later on, we need to think of honesty and we need to think of integrity. A falsified research data, a falsified result, and a misinterpreted result could mean a lot of damages in the part of the community and on the end users. Take note that your research can be published anywhere and could be seen anywhere. So there is a possibility that people might be accessing it for the purpose of curiosity also, and they might be future researchers also. So you would want your research to be scholarly and you would want to be honest about your work, okay, because that is how we're supposed to do it. Okay, and again, look at that new facts and the new relationships among which were already known that will contribute to the present body of knowledge. Now, nursing research is concerned with a systematic study, according to Vreeland, and assessment of nursing problem or phenomena. So we have the word there again, assessment. Here comes nursing research. Okay, so finding ways to improve nursing practice and patient care. So take note that it is not the personal interest of the researcher that comes into the picture. It is not the monetary gain of the researcher that comes into the picture on why we are conducting nursing research. Our intent is to improve nursing practice and improve also the patient care. Perhaps the delivery of the patient care to our clients. Okay, to also initiate and evaluate change and taking action to make new knowledge useful in nursing. That's the importance of our nursing research. Now, just for us to have an overview of what happened in nursing research, okay, we need to have a glimpse of the history. I know you love history, so a brief walkthrough about that. Now, the first nurse researcher known to us is Florence Nightingale, okay, our mother of modern nursing. So, Florence Nightingale is first nurse researcher. She has written the book Notes in Nursing, What It Is and What It Is Not, a book published in 1990. So Florence Nightingale, in the publication of his book, has already demonstrated the use of research methodologies, okay, through observation, recording, statistical analysis. And with that, she is able to develop her first theory, which is the environmental theory in nursing. Her theory, I mean, which is environmental theory in nursing. So known to be the first nursing theorist, okay, she has the theoretical orientation already, driven from the data available to her. Now, we also have Lydia Hall. If you can recall, Lydia Hall had been talking about the three aspects of nursing. According to her, the three aspects that needs to be taken care of by nurses are person or the core of nursing, the disease or the cure of nursing, and the body or the care of nursing. Oftentimes referred to as the three C's. So we have the core, the cure, and the care. Core would refer to person, cure would refer to disease, and then care would refer to the body. Lydia Hall, on the formulation of this definition, also is backed up of data available to her. Next, we also have Virginia Henderson. Henderson would tell us about the 14 components of nursing care, and she came to emphasize what is the importance of helping the patient with the activities and to provide conditions under which can perform unaided. Okay, so perhaps Virginia Henderson might have noticed that patients who are allowed to ambulate on their own, okay, tend to recover quickly, okay, than those who are overly taken care of by the nurses, or when the nurses do not allow for a certain degree of independence among the patients. Next, we have Peplau. Peplau had been talking about the therapeutic use of self. So Peplau on the psychiatric nursing. Peplau is talking about the therapeutic interpersonal process, the educative instrument, and then the maturing force that aims to promote forward movement of personality. Okay, she's referring here to nursing. Another theories that we have is Faye Abdella. So Faye Abdella has authored the 21 typology of nursing problems. So she has emphasized that the nurse is a problem solver. And with that, we can say that she is already inclined on research because she would want a nurse to be involved in problem solving. Then we also have Dorothea Orem. Orem had been talking about the self-care deficit theory. So in Dorothea's Orem theory, she has classified the patients as wholly compensatory, partially compensatory, and then supportive educative. Dorothea Orem has emphasized that wholly compensatory patient would need the full assistance of the nurse in order to perform the activities of a daily living, whereas a partially compensatory patient would need some assistance in the performance of care, whereas a supportive educative patient would only need some support and then some education, meaning the patient is more capable of doing independently his or her activities of daily living. Now we also have Martha Rogers. Rogers have been talking about the nature and direction of the unitary human being. She is on the development and derivation of descriptive, explanatory, and predictive principles. So if you would look at the theory of unitary human being, you'll be able to predict why a certain behavior is being presented by a patient. So Martha Rogers would want us to describe, meaning to describe the phenomenon, the way it exists, and then explain how come this phenomenon is occurring and try to predict, okay, what is the reason behind this phenomenon. So that's the goal of her theory, which are also inclinations of research. Then we also have Myra Levine. Levine is on the 4 conservative principles. She's been talking about the conservation of patient's energy. You also have conservation of structural integrity, the conservation of personal integrity, and then the conservation of social integrity. So Levine, in the practice or in the explanation of these 4 conservative principles, has also applied some research and statistics. Then we have Sister Callista Roy. Callista Roy, the adaptation theory, which would view human as a biopsychosocial being. So Sister Callista Roy has made a model which would explain how a human adapts to a certain incident or how we adapt on a certain case, for example, illness. So it is the adaptation model which would try to explain that. Now, among those theories that I have briefly shown you, those theories simply show that research has been in nursing for long. Those theories could also be the basis of our research as of this time. They could be considered as theoretical basis for our research. They could be the theoretical framework of our research. Try to look into the variables of these specific theories in such a way that you might be able to inject them in your own study. Now, allow me to give you an overview of research in the Philippines. So the nursing research prior to and during the 60s are focused on nursing administration, nursing education, and patient care. So there have been a lot of studies on nursing administration, how to motivate nurses, how come nurses are stressed, how come nurses in the clinical setting have the tendency to leave their work, how come nurses would be caring for this patient this way. What would be the effective modality for the care of patient? So modalities of nursing care would involve primary nursing, you also have team nursing, you also have case method. Okay, so these are some of the concerns dealt with in nursing administration. In nursing education, about a third of the studies conducted were about nursing education. So how to deliver or how to educate student nurses, these are the foci points. Then you also have patient care. So the message of this slide is that there should be an even distribution on the studies on administration, education, and patient care. Prior to 60s, there are very minimal studies about patient care. Okay, most of the studies are on administration and education. These studies have, of course, helped us improve our profession. However, our inclination is more on improving the patient care. That's why most of the studies are encouraged to be inclined on the care of the patient so that it will have its clinical significance. Now, nursing research versus research in nursing will be discussed in the succeeding lecture. Thank you very much for your attention.